Hello everyone, the new video or podcast on communication skills is about the effective information giving to patient. A framework using SPIKE protocol and 1H5W. I am Dr. Vishal Parmar, a pediatrician and communication skill trainer from Borivali. We will focus on the most important aspect of the patient care, the information giving. A well-structured approach regarding the information will trust, enhances understanding, and improve patient outcome. I will introduce you to two frameworks. The SPIKE protocol is a widely accepted for breaking bad news and a common 1H5W model, ideal for sharing general medical information. With both these tools, we can help you to communicate effectively in any clinical scenario. See, effective communication begins with understanding your patient's needs and expectations. A systemic approach can make even difficult conversation easy. Let us see the SPIKE protocol. SPIKE's protocol is widely used in clinical communication, especially when we are going to deliver the bad news or discussing complex medical issues. It involves a 6 steps. Step number 1, S. Setting up the conversation. Ensure privacy, minimize distraction, and sit at eye level with the patient or caregiver. Step number 2, P means perception. You must understand what the patient already knows. Ask the open-ended question like, what do you know about your child's condition or your condition, etc. Step number 3, I for invitation. We must ask how much detail patient wants to know. For instance, would you like me to explain the test result in detail or just want some summary? We must ask if they want any other person to attend this meeting or not. Ask. Step number 4, K means knowledge. We must share information in simple, jargon-free language, break it into the small parts and check understanding frequently, ideally every 30 seconds. Step number 5, E. Emotions. We must acknowledge and address patient emotions. We must use empathetic statement like, I can see this news is very difficult to you. But let me explain to you. The emotions and empathy can make a wonder. And last but not the least, summarize and strategize. We must recap the key points, outline the next steps, and answer every question and arrange the next meeting whenever it's possible. This is a general information sharing where the news is not distressing. Now let us see what is a 1H5W model works. 1H5W model means H means how and W means what, why, who, where and when. It's a very simple, straightforward, logical thing. This is to ensure no important detail is missed and the patient feels informed and empowered. Let us illustrate this framework with some examples. Like scenario 1, using SPIKE protocol. Imagine you need to inform a parents that their child has been diagnosed with type 1 diabetes. So here's how the SPIKEs can guide you. As you know, SPIKE means S-P-I-K-E-S. S means settings. We must arrange a private room, sit down with the parents and ensure that you won't be interrupted. Step number 2, perception. We must start by asking, what do you understand about the symptoms your child has been experiencing? What is the perception you must ask? Step number 3, invitation. We must ask, would you prefer I explain everything in detail or focus on the key point first? Let us know what is the expectation. We need to invite them to speak to know the expectation. Step number 4, knowledge. We must explain the diagnosis clearly. Type 1 diabetes means your child's body is not producing insulin, which is required to control the blood sugar. This can be effectively managed by insulin therapy and some lifestyle changes. So give proper and authentic knowledge, not to bluff, not to give false reassurance. Step number 5, emotions. Many times parents are getting serious emotional. We must acknowledge their feeling. I understand this. I understand this is overwhelming. It's normal to feel worried. But when we are here to support you, please express yourself and we are here to help you. We must recognize their emotions. And step number 6, summarize and strategize. Like recap, to summarize this, at the end of the meeting, your child has a type 1 diabetes. Our next step are to start with insulin therapy and arrange for the diabetes education session. Do you have any immediate question or concern? This can work one. Now let us go on the scenario number 2 using 1H5W model, which is a very practical and logical model. Let us explain about the rotavirus vaccine using 1H5W model. The patient will ask, how does the vaccine work? We can answer, the rotavirus vaccine works by training your child's immune system to fight the rotavirus which causes severe diarrhea in infant. So maybe ask, what is the vaccine? Vaccine, it's an oral vaccine. We can give it by drops and it is a part of routine immunization schedule. This is rotavirus vaccine. Person may ask, why the rotavirus vaccine is necessary? Because rotavirus can cause severe diarrhea which can result in severe dehydration and hospitalization. To prevent this, we are giving the rotavirus. Then may ask, who should receive it? Ideally, all infants should receive the rotavirus vaccine. The first dose is recommended at the age of 6 weeks of age. Now the question, where can I get this vaccine? Vaccine is available at our clinic or in government health setups or any recognized standard medical setup. We must acknowledge it. And step number 6, when should it be given? Usually it can be given in 2 to 3 doses starting from 6 week, 10 week, 14 week, and we can give up to the 6 month. So this question about the how, why, what, where, when, who will satisfy each and every curiosity of the patient or parents. So by using this SPIKE protocol for the sensitive discussion and 1H5W for the general information, we can handle both complex and routine conversation with ease. Let us see some practical example. Imagine a parent is worried about the child's weight gain and eating habit. How can we approach this with a SPIKE? We need to start by understanding their perception. What concerns you most about your child's eating? Then invite their preference. Would you like me to focus on possible causes or start with a general advice? You must share some knowledge about the healthy growth pattern and address emotions by empathizing. It is natural to worry, but we will work together to create a plan. And at the end, we need to summarize by suggesting follow-up and nutrition guidance. Now let us see 1H5W model and use it to explain the dietary changes. How we can do it? We need to encourage a balanced meal with protein, carbs and healthy fats. What we can do? We add foods like eggs, fruits and vegetables. Why we need to do? This provides nutrition which we require for the growth. And who can do? The entire family can follow this plan to support the child. Where we can do? We will share recipe and meal ideas during your next visit. And from when you need to start? You can start it from now only. And we need to monitor the progress weekly. So combining this approach ensure the parents feel supported and so in conclusion, the SPIKE protocol is your go-to for emotionally sensitive conversation, while the 1H5W model is perfect for structured, straightforward information sharing. These tools can transfer your communication skill and help you build long-lasting trust with the patient. Thank you for listening to me regarding the communication and counseling skill for the healthcare profession. If you found this helpful, please subscribe it, like it and share it with your professional colleague. Join me next time for the more tips to enhance patient care to the effective communication. This is Dr. Vishal Parmar signing off. Thank you. Namaste.